morning, Mr. Jones. My name is Kate. I'm a Maria College nursing student. I'm going to be working with you today. Before I begin, can I get your full name and date of birth for me? All right. Mr. Jones has given me his full name and date of birth. It matches his wristband. And Mr. Jones, do you have any allergies? Mr. Jones states he has no allergies. And Mr. Jones, are you in any pain today? Mr. Jones states he has no pain, a pain rating of 0. All right, Mr. Jones, you have a PICC line on your arm, so I need to assess and make sure that it's patent, and you also too have some meds I need to give you so that your doctors order your meds for the day. So Mr. Jones, I'm first going to check your orders, make sure everything looks correct, and then I'm going to come back and I'm going to look at your line, flush the line, and give you your meds, okay? All right, Mr. Jones states he understands. All right, so in Mr. Jones's chart, I have orders written down for heparin, 500 units IV push. Also to ketorolac tromethamine, 15 milligrams daily IV push. And then also to, before administering the meds, I'm going to flush both lines and check for blood return. So I've got my orders. I'm now gonna go check my MAR to make sure my MAR matches these orders. So in my MAR, I have the ketorolac tromethamine, 15 milligrams daily IV push, so that's good. I then also too have the heparin, 500 units IV push, so that also too, it matches. I have pulled my meds, so now I'm gonna check my meds and make sure that they are matching my MAR. So I have my ketorolac tromethamine, 15 milligrams in a 1 ml vial. So that matches my ketorolac 15 milligrams daily, which is going to be IV push. I also too pulled my heparin, and it's 100 units per ml, and I'm going to be giving 500 units. So this matches. I'm going to pull up 5 mLs of my heparin. All right. So to know more about the meds before I'm giving them, I'm going to look up both the meds and check their indications on why I'm giving them, implications, and the side effects I should be watching out for. So I'm first going to begin with my heparin. This is to prevent clotting off in the IV line, so for patency. My biggest adverse reaction that I'm going to look out for are signs and symptoms of bleeding, and then also to heparin-induced thrombocytopenia. For IV therapy, for line flushing, it's 10 to 100 units per ml. So we're safe with my flush of 500 units. My biggest thing again is assessing for signs and symptoms of hemorrhage, monitoring platelet count. I'm going to administer it undiluted and for at least 1 minute. Next med, ketorolac, so it's indicated for short-term management of pain. My biggest adverse reactions to look out for is heart failure, myocardial infarction, and stroke. Also to DRESS, Stevens-Johnson's, and toxic epidermal necrolysis. Looking out for GI bleeding and hypersensitivity reactions. For dosage, the IV for adults is a single dose of 15 milligrams, which is a safe dose because I'm giving 15 milligrams. I need to assess for rhinitis, asthma, and urticaria. Also assessing for rash to see if any signs and symptoms of Stevens-Johnson syndrome, DRESS, or toxic epidermal necrolysis. For the push, I'm going to administer it undiluted and over a rate of at least 15 seconds. So I've got now my information about my meds. So I'm going to start drying them up. So I've got my syringes and my needle tips too. So first thing I need to do is I'm going to scan Mr. Jones. And so I'm now in his chart. I'm going to make sure, so I'm going to scan my ketorolac first. So I've scanned my ketorolac. So that looks good. I'm going to then begin to, just wash my hands one more time. Since I did not open this up, I'm going to clean the hub for a minute. So there's my minute. Now my order is for 15 milligrams. This vial is 15 milligrams per 1 ml. So I'm gonna make sure I draw up my 1 ml. So I've gotten my 1 ml drawn up. Gonna then do my med name, so it's ketorolac. Then my dose is 15 milligrams per ml. I have 1 ml. 1 ml is my total volume. There's no dilutant. Today's date is the 7th, and I have my initials. So I've got my med. There. All right. So then I can put let's see. Now I'm gonna do my next med. I'm gonna scan my heparin. So again, I've got my heparin, my 500 units. So this is 100 units per ml. So I need to draw 5 mLs to then give my 500 units dose. Again, I did not open this up fresh, so I need to clean the hub for a minute. For a minute. So again, I'm gonna draw up drop 5 mLs. Gotta drop a little bit past because this one because of how it is. All right. So then my 5 mLs. So let me do my labeling. So this is my heparin. It's 500 units. It's 5 mLs. My total volume in this is 5 mLs. It is now 427. My initials. There's no dilutant. All right. So got all my meds labeled. Do my 500 units on here. And then okay. All right. So now that I've done my checks, I've got my meds, I'm now gonna go over. So I'm now with Mr. Jones. So Mr. Jones is still doing good. First thing I'm gonna start with is I'm going to check for patency and blood return on my port that I'm not gonna draw my med up on. So, let's see. All right. So, I'm gonna clean this hub for 1 minute. Both my lines are locked. So, minute. I'm now going to flush my line, twist on, all right. So I'm gonna unclamp. Now I'm gonna just push my line, all right, pushed a couple of mLs, going good. I'm gonna pull back to check blood return. So I've got some blood return, so everything's patent. Now I'm gonna continue, flush the rest of the line. Everything looks good at the IV site, at the PICC line site. It's got the bio patch in place, the transparent dressing. Last time the dressing change was done is noted on the side. So that 10 ml flush was great. I locked the line, can unclamp, draw out the syringe. Now this line, IV line is set, so I can let it drop. I'm now gonna clean my part of the PICC line that my meds are being delivered in, so I'm gonna go for 60 seconds again. Again, it's clamped already. Full 1 minute of cleaning. I'm now gonna flush, and again, do the same thing that I did on the other line to this line. So unclamp, gonna start my flush. So no resistance, it's flushing good. I'm now gonna pull back to check for blood return. I've gotten blood return, so now I can continue and finish my flush. So this line is patent. Beautiful, so the flush ended. So then now I can do that. Okay, toss that. I now am going to clean for the 15 seconds before I give my med. Alright, so I've cleaned that. Now I'm gonna give my med, the Ketorolac. I've got the 1 ml. My Davis drug guide told me to push for at least 15 seconds, so I'm gonna go for 15 seconds. I've also to release all the air bubbles from my syringes, so no air bubbles are going in. All right, so the Ketorolac went in good. Gonna then take my sharps. I now am going to clean my hub for another 15 seconds. Okay, then I'm gonna now follow up with another flush. And for this flush, for the first ml, I need to make sure that it pushes in for 15 seconds. So I'll go slow. All right, so 15 seconds for my first ml. I can now push for the rest. Flush has gone through, clamp my line, untwist. All right, so now I'm going to clean for another 15 seconds and then I can administer my heparin. All right, it's been cleaned. I can now administer my heparin, so I'm going to give my 500 units of heparin. My Davis drug guide said to administer over 1 minute, so at least for 1 minute. So I'm going to unclamp and then I'll slowly start to push. So I push for my 1 minute, can clamp my line. I can let my line drop because nothing follows the heparin flush. Get rid of my trash and my garbage. All right. So now we'll wash my hands. I've appropriately documented that my meds have been given in my chart. And then, all right, Mr. Jones, are you doing all right? No pain with everything with giving the meds? Mr. Jones states no pain. All right, Mr. Jones, you've got your call bell next to you. If you need anything, press the call bell. I'll come back and I'll check on you in a little bit. So Mr. Jones's bed's locked in the lowest position. His call bell is within reach, and he states that he's good. So.